All right, we're going to go ahead and get started. Thanks everyone for joining us today. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Thanks for joining the live video stream. If you have questions as we go through the video today, feel free to put those in the comment section. We'll try to answer those questions at the end of the stream. If you have questions after watching the recording of this video, reach out to us via social media. We'll always try to answer those questions as soon as we can. So with that, it'll be a little bit of a shorter video today, but I wanted to share some of the vaccine data resources that are up on the state health department website. So you can see the URL at the top of the page, dhs.wisconsin.gov/COVID-19/vaccine data. And really just wanted to, some of the stuff we've looked at before. So I want to talk through it a little bit in review and then show you some of the new features that they are adding. So they're trying to add additional data pieces, and it's kind of a complement to the data that we have on our Rock County Public Health Department website, where we try to capture additional pieces of data that may not be captured by the state dashboards, but trying to make sure that there's limited duplication of the data that's available so that you have more information available instead of duplicate information available. So with that, we're looking at the vaccine dashboard of the state health department, and we can see that the darker shades of green on this map correlate to a higher percent of residents who have received doses of the vaccine. At the top of the visual, you can toggle between whether you want to see those who have received at least one dose of the vaccine, who have completed the series, adults who are 18 or older who have gotten one dose or completed the series. So when we look at the state data across the entire state of Wisconsin, more than 3.1 million people have gotten at least that first dose of the vaccine, which is about 54% of the population. And when we look at those who have completed the vaccine series, we're looking at 51% of the total population, and just under 3 million people have completed that vaccine series. You can also see the number of people who have completed the series or gotten at least that one dose by age group. And as you mouse over these bars, it will tell you the specific information. So looking at the 12 to 15-year-old population in the state of Wisconsin, we have 33.9% of this population who has completed the vaccine series, and just over 100,000 of those Wisconsin residents have completed the series. And as you mouse over counties on this map, a little pop-up will show with a snapshot of the data for that county. So as we're looking at Rock County, we see the percentages and the number of people who have received at least one dose and completed the vaccine series. And if we click on the map, we can actually see the specific data related to some of these other demographic factors and the vaccination coverage. Again, as we toggle between those who have completed the series and those who have received at least one dose, it will update the data, and still we're looking at Rock County information. So you can see that about 53.5% of the Rock County residents have gotten at least one dose of the vaccine. We continue to see steady increases, although I think the increase has slowed down quite a bit since kind of the peak of when the vaccine was being administered. At the bottom of the graphic here, you can see the number of doses for Rock County residents by week. So this is both first and second doses that were administered. You can see that we had a nice increase, and lots of people were getting vaccinated kind of between March and May. We've kind of slowly seen this taper off, where we're not seeing as many people be vaccinated, although recently we're seeing a slight increase in the number of people who are showing up specifically to get their first dose of the vaccine. So I think that's some positive news in terms of looking at how many people we're vaccinating and how many more people are getting vaccinated. I do want to share, I'm just scrolling up to the top of the screen. So there is a new promotion now where those who get a first dose of the vaccine are eligible to get a $100 COVID-19 reward. So just scrolling through the information, this is a state program. This isn't a Rock County program, but basically anyone who gets their first dose between August 20th and September 6th and they meet some of the requirements, they can get a $100 reward. So that would be a nice little added benefit, added motivation to get your COVID-19 vaccine. The vaccine is no cost to you. There are many vaccine providers in Rock County. You can go to rockcountyshot.com to see who is providing the vaccine and where to get that free vaccine. And then you're also eligible, if this is your first dose in those time ranges, you're eligible to get a $100 reward. So if you are interested in this, you can call this number. So it's 877-947-2211 or dial 211 to get more information on this promotion. So just wanted to share that information with everyone, but I'm going to go back to the dashboard page and show you a little bit more information that's housed. So we have the dashboard. We kind of talked through that. There's indicators about the demographic groups who have received their vaccines. And then as we scroll further down the page, we load a map, and it's showing me the East Coast, but we want to see Wisconsin specifically. We'll zoom in here. And so the darker shade of blue correlates to a higher percent of population who have gotten at least one dose of the vaccine so far. You can toggle down here at the bottom, these tabs, you can toggle to show the percent of the population who has completed the vaccine series. This is by census tract, so this is kind of like a neighborhood level in certain areas. So Janesville and Beloit, you'll get to see a little bit more detail in this map. I'm just scrolling in here, zooming in, so you can see these census tracts and what percent of the populations within these areas have been fully vaccinated at this point, to start to get a sense of, if you live in these areas or if you're traveling to these areas, which areas have higher or lower vaccination levels. I'm just going to scroll out here a little bit so you can see Rock County, Greene, Walworth, Jefferson, and Dane. We can also look at the data by municipality. So there are different ways we can tabulate this information and take a look at this data. So say you are interested in looking at how the rates differ by municipality. We'll zoom in on Rock County. And you can see the data for our municipalities. So say we wanted to see Evansville, for example. We click on Evansville. The city of Evansville has about a 70% rate of those who have received at least one dose of the vaccine. We can always toggle to the completed vaccine tab to see that information. And additionally, we can see information based on school district or zip code areas. I'm not going to go through that because it's very similar. It will provide the same color grading where the darker shades of blue indicate a higher level of vaccination, but you will be able to see those rates by school district and also by zip code. So you can get a sense of where your community is at currently with the vaccine rollout and which areas have higher or lower vaccination coverage. And if you're interested, the state does provide plenty of opportunity to download their data in the spirit of being transparent and showing the data in these visualizations, but also providing the data to the public. There are download features available as well. And then the other piece of information that the state has added is this, it's on a tab called COVID-19 illness after vaccination. And really, the graphic is demonstrating how many people are fully vaccinated and have caught COVID-19 versus how many people who are not fully vaccinated who have gotten COVID-19. So looking at the data, you can mouse over this particular graphic and it will give you a little pop-up of additional information, but these are standardized. So this is a per 100,000 rate. So based on the number of people who are fully vaccinated, how many people contracted COVID-19 after completing the vaccine series and having that 14-day period after their last dose of the shot, how many people per 100,000 fully vaccinated people developed COVID-19. And in the state of Wisconsin, it's 125.4 cases per 100,000 fully vaccinated individuals. By comparison, when we look at those who are not fully vaccinated, so this includes people who maybe have just one dose of the vaccine, there are 369 cases per 100,000 not fully vaccinated people. In terms of the hospitalizations, of those who are fully vaccinated, there are just under 5 hospitalizations per 100,000 fully vaccinated people. By comparison, there are more than 3 times higher rates of hospitalization among those who are not fully vaccinated. And finally, the deaths, it really barely shows up here on the graphic, but 0.1 deaths per 100,000 fully vaccinated people due to COVID-19. By comparison, 1.1 deaths in the not fully vaccinated group per 100,000 not fully vaccinated people. So this is an increase of about 10 times. So there are 10 times higher death rates among those who are not fully vaccinated. So I think this graphic just illustrates the point that the vaccine is highly effective at preventing severe cases of COVID-19 and keeping people out of the hospital and reducing the risk of severe complications and death. So that's what I wanted to share with everyone today on the stream. I'm going to pause here and just take a look and see if there are any questions in the chat box. All right, looks like there are no questions for today. So I'm going to go ahead and stop sharing, but I do appreciate everyone tuning in for the stream today. And if you're watching the recording, thanks for watching the recording. And we will talk to you in 2 weeks. All right, stay safe and healthy, everyone, and we'll talk to you next time.